Hi, this is Dr. Alisa Kriegel, and you are here with the podcast, Let's Talk About Sex Really. So, today's topic is let's talk about menopause. Um, really talking about menopause is also talking about perimenopause. So I'm going to explain uh, a bunch about this topic. And really what inspired me is I keep having conversations with women um, who are in the age of perimenopause or menopause. And there's just so little information or mixed information. And this is to really just share a bit of what I have learned. I'm not a medical doctor, but I have been following issues. I've always been fascinated with issues around hormones. Being a clinical psychologist, I realized that a lot of mood issues, especially mood, anxiety, um, changes in people's kind of just sense of themselves oftentimes corresponded with hormones, with being premenstrual, having difficulty or with their periods, having premenstrual dysphoric disorder, which is a severe, people can get severe mood changes during or before their periods, changes in testosterone for men can affect mood, and as well as all of these hormonal changes can also affect libido and how we feel sexually. So I really think that it's important to understand at least the basics, um, and really to be aware of how it might affect you. So one of the things that's happening right now, we're in a really interesting time because perimenopause and menopause has become finally really front and center and talked about a lot. And when that happens, it's always, I think it's fantastic. But what also happens is you get the commodification of illness or of issues that affect a lot of people. And obviously, every woman will go through some type of perimenopause and then menopause as things change. So let me give a quick definition. Perimenopause is basically the period in life. It's usually anywhere from 5 to 12 years before menopause. Perimenopause is a fluctuation in female hormones. So during perimenopause, your period might get a little wonky, a little funky. Sometimes it comes, sometimes it doesn't, sometimes it lasts longer, sometimes it's shorter, sometimes it's heavier. But if you had a fairly regular period, it may not be that regular anymore, and it can be very confusing. Menopause is the period, the time, 12 months without any period, without any menstruation. So once you have 12 full months without having your period, then you are technically in menopause. I have known a lot of women, myself included, who will be at like 11 months and then all of a sudden the period starts again. So, just some of the fun of the roller coaster of being a woman. What has been found, and I started noticing changes, I think, like in my late 40s, um, especially early 50s, especially regarding sleep and mood. And I was like, what's going on? And that's when I started doing a deep dive into perimenopause and hearing about it and learning about it. And prior to that, I think I was with a lot of women that thought menopause is when your period ends, and that's when the problems begin. That's when you get hot flashes. That's when you get low libido. That's what um, all the fun stuff happens. And I had never really heard the term perimenopause. So it's like, how have I never heard this? And in speaking with other women, no one had heard it. And this was probably about 12 years ago. So when I started researching it more, what I learned is there's a host of symptoms that I think can get confused with just stress and aging. And while those can definitely exacerbate things, part of the symptom picture, and there's a lot, but the big, the big ones are, you know, brain fog, hot flashes, sometimes night sweat. So hot flashes can happen in the day, just a sudden uh, onset of just feeling really heated through your whole body. Night sweats is really just waking up. And I have a dear friend who I think would go through like 3 t-shirts a night. Her night sweats were so bad. Sleep can be affected. I was always someone who was a really solid sleeper. And I think that was the biggest change for me, and the big aha that something's going on is I was waking up regularly, like every 2 to 3 hours. So sleep can change mood. Definitely, you can have more anxiety, more mood swings, more depression, more irritability. Libido can get, for most women, as the hormones are fluctuating and becoming less, libido can also go down. Dryness happens. You'll notice more dryness in your skin, in your hair. Um, that includes the vulva, and you can have more dryness in the vulva and the vagina. And one of the other symptoms that can happen in perimenopause or menopause is something called vaginal atrophy, where the skin of the vaginal lining gets so dry that sex can become really painful. And that's really important to understand. I think understanding sexuality and sexual issues around perimenopause and menopause, it's really important for both men and women to understand what might be going on. So if you are finding sex more painful, if you are not getting as wet or as turned on. I know that was a strange symptom, to feel turned on, but not having sort of the bodily activities that go along with that, not getting as wet, not having that kind of self lubrication can feel very strange because your body's just not working the way it once did. This is where things like really making sure that you have lube during sex is so important. It is not a sign of shame. It is not a sign that you are not turned on. It is really to help with ease and pleasure and to make the whole sexual experience just feel better for everyone. So I would say finding a lube that is, you know, more, fairly like free of chemicals, do a check. I like EWG website to make sure you're not putting extra chemicals into your body, but finding a good, clean lube is really important. I highly recommend it. And the other piece that I really recommend around some of these changes that happen in perimenopause and sex is this idea of vaginal atrophy. It's sort of a use it or lose it. And I think it's really important for our sexual health that as women, as we age, that I think it's important emotionally to stay connected to your body. And especially at a time when your body's changing so much, that can be really difficult and feel odd and feel stressful, but all the more so, I think it's important to find some way to stay connected with a partner, with yourself. I think I've mentioned before, there's a product I really like called Taboo, Tabu, that was developed by a young woman who had been in conversation with her mother about this sort of topic of use it or lose it, and created, I think a lot of women are more comfortable now. The sex toy industry is booming. It's amazing. I have a podcast on sex toys that is one of my top listened to podcasts. So take a listen if you haven't listened to it already. But I think there are still some women who aren't comfortable with the idea of using a toy or using a vibrator. Um, what's nice about taboo is it's very erg ergonomic, like it's shaped very simply. It's thin, so it's very comfortable, and it's especially for someone who maybe has had some pain with penetration or intercourse. It comes with its own very nice, like moisturizing lubricant, and it can also have like a warming setting. So it's not necessarily to get off. It's not if you, it's really promoted as sexual wellness. That the idea of having and continuing to have something inside the vagina, something keeping it stretched and exercised and lubricated is going to help with the general health of your vagina for a much longer time. So I really like the idea of this sort of sexual wellness. We do so much in our lives to kind of keep our skin healthy and our hair healthy and to keep our bodies strong. And there's so much talk about like osteoporosis, which bone density issues definitely come along during menopause. There's a loss of bone density. And so we pay attention to, we should be lifting weights, even light weights on a regular basis to help with bone density. But not a lot of people talk about sort of sexual wellness and the health of our vaginal skin and our sort of staying juicy, staying fresh and healthy and that sense of aliveness that comes from our sexual health. So the idea of the taboo is it's not just a vibrator to get off, which is great, awesome, go for it. But it is really about the more internal health. And it is really a tool to help prevent vaginal atrophy. And I've worked with clients who've had extreme vaginal atrophy, and it is very painful and it makes intercourse next to impossible. And it takes a long time to undo. And it's not always possible to fully undo. So I really recommend if you are in, the 40, 45, if you're at 40 over, to really be thinking about this if you are not sexually active with a partner, and having intercourse or penetrative sex, or are with a female with a female partner, and you are not regularly doing something with a vibrator or dildo for that penetration, then think about, or if you're not masturbating regularly, then really think about what you can do to maintain your vaginal health, your sexual wellness. So taboo is really lovely for that, TABU. Um, so the perimenopause symptoms are really happening anywhere from 5 to 12 years before menopause. For most women, the average age that's given for menopause is late 40s to early 50s. That's the average age. Early 50s, mid 50s are a little more unusual. I'm someone who's at the high end, lucky me. I kept thinking I was in menopause and I wasn't. Um, so two big issues around sex and this. One is pregnancy. During perimenopause, a lot of doctors and a lot of women think, oh, I'm barely getting my period. I can't get pregnant. Well, surprise. You should still, if you are sexually active, you should still be aware that even though your period may be barely existent, doesn't mean you're in menopause. So I learned this shortly before I turned 52 with an accidental pregnancy that was 3 months along. Look at that. Because my period was so infrequent that I don't think I even recognized that something was going on. Because it was like, oh, I'm just not getting my period. I haven't had my having having my period off and on for months at a time was kind of the norm for me. So I think it wasn't until like the sort of close to the 3 month mark that um I had a telltale sign, which was during my first pregnancy, my craving was dolmas. They're the Greek little appetizer grape leaves, rice stuffed in grape leaves. And I craved them all through my pregnancy. And I remember going to a holiday party in December, and dolmas were out. And I was like, so like, usually I can see them. I was like, oh, great, I'll have one. But the craving was back. And the breasts were super sore. And I was like, this is weird. And my boyfriend was like, it's not possible. You're almost 52. Long story short, I did a pregnancy test and surprise, I was pregnant. Luckily, I was really concerned about 52-year-old eggs and 54-year-old sperm. But uh, luckily I miscarried at about 3.5 months. So that was actually a relief, but also a surprise. And my gynecologist now warns all of her perimenopausal clients to use birth control, and that, yes, in fact, you can get pregnant during perimenopause and much later than you think. So 52. Now, the chances of it are pretty slim. I think we looked it up, and the chance of natural pregnancy at 52 was somewhere around 0.001%. So, yay me, won the lottery on that one. But it's possible. I found it fascinating that I have like now changed my gynecologist's behavior. She never warned her female patients about that until me. So yay, me. The other thing, so yes, you can get pregnant during perimenopause, even though so much is happening. The other big issue that I think really affects women and how you feel about yourself and all of these symptoms and your libido and sex is something that became very controversial in the last 2 decades, and that's hormone replacement therapy. And what had happened is in 2002, there was a women's health initiative, did a study. It was a flawed study, but it was sensationalized. And what some of their findings were that there was they found a slight increase in breast cancer among women with HRT who took hormone replacement therapy, which is basically some combination of estrogen and progesterone, which are the female hormones that are getting decreased during perimenopause up through menopause. So what's really unfortunate is the media, as they tend to do, love a sensationalized story, especially when it's negative for women. So let's not research this further. Let's take this one study, and everyone jumped on the statistic, which was actually completely misunderstood, that HRT significantly increases breast cancer in women. What's really incredible is that prior to 2002, HRT was very common and was sort of a course of action for most women. In fact, it started in the 60s, HRT, and it was sort of a standard, definitely in Europe and in the United States. So much so that I remember someone posted a clip of episode from All in the Family with Edith, the mom, and Gloria. And Edith, who had sort of the reputation of being, a little bit flaky, is speaking really matter-of-factly, like Gloria's talking to her about not feeling great and all these symptoms that she's having that are basically perimenopause. And Edith is telling her that she should go on hormone replacement therapy. Like matter of fact, in the 19, this was probably like in the early 70s. And it was like, no one's having that conversation today. And I was really floored. Like, why is no one having that conversation? And yet, 50 years ago, that conversation was like normal enough to be on like a family television show. So something this study and the sensationalizing of it really changed about what the statistics show is that HRT use declined by about 46%. It's like almost half. And if I speak with my friends or when I speak with female clients who are in that age range, very few of them have ever been told about hormone replacement therapy. And I myself was referred a doctor in New York City who only specializes in hormones. Like this is what she does. And I really wanted to understand more about my symptoms and what was possible. And I had heard about the study and I was concerned. And she really explained to me, what everyone got wrong about the study, where there is risk, where there isn't risk. New studies have been done. The original study from 2002 has been recreated, has been looked at closer. There was a lot of flaws in how they looked at cancer. The other really interesting thing is after this Women's Health Initiative study, they believed that less women being on hormone replacement would decrease the rate of breast cancers and other like uterine cancer, endometrial cancer. And in fact, it didn't at all, didn't affect the rates of cancer. So not only that, but then the redone studies showed that what those findings were really incorrect and flawed. So it's not to say there's no risks. I definitely recommend people to not just speak to their gynecologist, to make sure your gynecologist really is a specialist in this. Part of what's really scary right now is there is a lot out there that is just looking to make money on women's health issues. And so the most recent one was I had a client who was seeing her gynecologist for a long time, a male gynecologist, much older. Um, I think she felt bad to to leave him to find a different person, but I'd been encouraging her to do so because he really was minimizing her perimenopause symptoms and sort of saying, well, you're too young to be in menopause, which there's women who unfortunately go through menopause as early as their late 30s, early 40s. In fact, Naomi Watts, the actress, wrote a wonderful book, Dare to Speak, I think it's called, about her experience with very early menopause, and how she found out and how she tried to get pregnant before it, and all of this, at a time when this really wasn't talked about as much. My client's doctor, the sort of final straw was he recommended her go on these pellets. I guess there's these pellets that I don't remember what company's putting them out, some sort of hormonal pellets. But when I looked them up, they have horrible effects and reviews, and they are not supported by any of the women who I follow. In fact, they can be more harmful. But, a lot of these doctors sadly get kickbacks and get, brought to dinners and lunches and get all sorts of sales incentives for encouraging getting their clients on certain meds. So what I recommend is really finding someone highly reviewed who is a hormone specialist. The woman I saw is not, doesn't do regular gynecological um, visits with clients. She really does just like an initial testing and figures out, and then follow up after she figures out like what hormones would be best for you, what hormone replacement, always using sort of the highest quality products. And I found it like life-changing, game changer, sleep is better, everything. The other fun part of perimenopause is like incredible food cravings. And, so if you're up all night, weight gain, weight during perimenopause and menopause goes to the middle. Our weight sort of reconfigures itself. So a lot of women really struggle with that weight gain, and clothes fitting differently and just feeling different in your body. Um, HRT can help with that somewhat. It's different for everyone, so not completely, it's not a complete miracle, but something that is really helpful. So I really encourage everyone. I think people, ever since that study and all the sensationalizing around it, everyone is really scared. And I really, really, if you're noticing any symptoms, I really encourage you to go and speak to um, an doctor who really specializes in women and hormones. It can be a big change. And it's fascinating because I think even in my own group of people who I know, very few people are on HRT. And I've spoken to a lot of people about, check it out, try it. It's not what you think. It's not the dangers that you think, but it is really important to find out information for yourself and not just take my word for it or a friend's word, but to figure out what you need. Don't do hormone replacement things that you can buy online or bioidentical creams, or really go to a doctor. Like I said, there's so many products aimed now. It is a multi-billion-dollar business. The one person who I really follow is a Canadian gynecologist. Her name is Dr. Jen Gunter, Gunter. And she really digs into the research. She really like breaks it down, talks about like these, if there's big products, or I believe there was like a big menopause kind of conference video documentary thing on Netflix or something. I think the actress Halle Berry might have and started it with a lot of people. Dr. Mary Claire Haver is a big person. She now sells her own supplements. My kind of rule of thumb is, if someone's giving information, great, but if they're starting to sell their own products around their information, it makes me a little more wary. So Dr. Mary Claire has some great things to say, but take it with a grain of salt. She's also selling a lot. So Dr. Jen Gunter is the person I trust. She's really just digging into the research and breaking things down. So if you want to take a look and follow her, she has some great books out there, and I'll put the links in the show notes for this podcast. Um, but those are the things that I wanted to leave you with. The other thing, just on a brief note, is men go through a type of menopause. There's memes and people will joke about menopause. It's actually called andropause. And men have a slow decline of testosterone as they get older. And that can affect libido. It can affect erectile issues. It can affect decrease in muscle mass. It can affect weight gain. There are real symptoms around that. The difference is it is a slower decline. Women have this really abrupt and then fluctuating, and then it's a longer, but men may be feeling different around their sexuality as well, and their libido. And obviously, erectile issues can really impact a sense of virility and feeling shame about it, or feeling, really feeling your age, or feeling like something's wrong with you, you're not good enough. And I think some erectile issues, as well as like these issues I'm talking about of women's libidos going down, can affect partners, right? Can like, are you not feeling turned on? Am I not good? All of these things that we get in our head about. So once again, really important to talk about it. Talking about it's great. It can feel uncomfortable. That's okay. It's more uncomfortable to not be having sex or to be having sex and being in your head or to be making assumptions that just aren't true. Um, Again, for men, talk to your doctor, figure out which of, if you do are having issues, erectile issues or libido issues, or there are also mood issues that can come with lower testosterone. Again, don't just go off the internet. Speak to a doctor. Some men are given low doses or of testosterone, and that can be really helpful. Obviously, there's a whole host of medications out there to help with erections. Figure out which are the ones that work for you. They all work a little differently. They all might feel a little different. Um, Mood, talk to someone about if it's really declining, about, speak to a therapist, speak to a psychiatrist, get on an antidepressant, or, exercise, nutrition, all of that. Can sometimes make a big difference. The difficulty is if you're depressed, it's really hard to do that. But there are basically, you don't have to suffer in silence with all of these things. These are natural changes of our bodies. We are all going through it in some way or another. Some will have more symptoms, some will have less. It is not anything to be ashamed about. It's something to own. It's something to look into. It's something to really research and not just take as inevitable, but figure out what can make you feel your best and what can help you feel your best in your life in general, in your social relationships, and also in your sexual being, in keeping that sexual connection alive. There is no reason why sex needs to change as we age. In fact, I think right now, STIs or STDs, STIs, sexually transmitted infections, are on the rise and have been for a while in the 70 plus community. Apparently, people who are in these um, older communities or even in nursing homes are getting it on. So STIs are on the rise. So yeah, sex doesn't have to end because hormones are changing. So I will put all of these notes in the podcast show notes and take it, I hope this has been helpful. Do your own research, figure out what's going to work for you, but do not think this is it. It's not. So, hope this has helped. Share this with friends, share this with partners. It's really important to understand and take care of yourself and stay sexy. Okay. I will be on Instagram at Let's Talk About Sex _really. Follow me there. There'll be more information to be found. This podcast episode can also be found on YouTube or on any platform where you listen to podcasts. So thank you so much for joining me. I will speak to you soon. Bye.